Wegovy and Zepbound can produce weight loss in people with polycystic ovary syndrome, or PCOS, who qualify for obesity treatment. They cannot cure PCOS or treat every hormone symptom. They work best when excess weight and insulin resistance are driving the problem. They should not be used during pregnancy, and they are not substitutes for proven fertility treatment. The target must match the real problem. The syndrome can cause irregular egg release, excess male-type hormones, and insulin resistance. Insulin resistance means the body needs extra insulin to control blood sugar. That extra insulin can push the ovaries to make more of these hormones, disrupting regular egg release. Wegovy, which contains semaglutide, and Zepbound, which contains Tirzepatide, reduce appetite and promote weight loss. As weight falls, the body often responds better to insulin. Lower insulin may reduce excess hormone production in the ovaries, making periods and ovulation more regular. PCOS is not one uniform condition. These drugs usually help indirectly by changing weight, appetite, and insulin resistance. They do not permanently reset the ovaries or correct every cause of excess hair, acne, and irregular bleeding. Even the name PCOS can mislead. Some have many small follicles, which hold immature eggs on ultrasound. Others do not. Diagnosis usually requires 2 of 3 findings: irregular ovulation, too many male-type hormones, or many ovarian follicles, after other causes are ruled out. Patients with the same label may need very different treatment. One may have obesity, prediabetes, and strong insulin resistance. Another may have a normal body mass index, severe acne, and irregular periods without a major weight problem. For the first patient, Wegovy or Zepbound may address a major driver. Weight loss can improve blood sugar, waist size, blood pressure, and sleep apnea, which causes repeated breathing pauses during sleep. It may also make periods more predictable, but not reliably. For the second patient, these drugs may offer much less. Someone who is not overweight or obese usually does not qualify. Weight loss alone may not improve acne, scalp hair thinning, or unwanted facial hair, which often need separate treatment. PCOS evidence is promising, but smaller than obesity evidence. Neither drug is approved specifically to treat PCOS. Most PCOS studies examine similar weight loss medicines rather than Wegovy or Zepbound specifically. These studies show weight loss and better insulin response, but evidence for live birth or lasting symptom control remains limited. More regular periods do not mean PCOS has disappeared. A returning period after weight loss may simply show that ovulation has improved while the underlying tendency remains. Weight regain or stopping treatment can allow earlier problems to return. Better ovulation also creates an immediate pregnancy issue. Someone who rarely ovulated may become fertile before noticing a clear cycle pattern. Pregnancy can happen unexpectedly, even after months or years of assuming conception was unlikely. Improved ovulation may arrive before the patient is ready. A weight loss drug can change pregnancy risk without acting as a fertility medicine. Contraception and pregnancy plans belong in the first visit, not after a missed period. These drugs should not be used for weight loss during pregnancy. Wegovy should be stopped at least 2 months before a planned pregnancy. Zepbound should also be stopped before trying to conceive, with the timing chosen by the prescriber. Zepbound also slows stomach emptying. This can weaken birth control pills when treatment starts or doses rise. People using birth control pills should use a non-pill method or add condoms for 4 weeks after starting, and each dose increase. Even with reliable contraception, side effects can limit long-term treatment. Nausea, constipation, diarrhea, reflux, and vomiting are common during dose increases. Severe or persistent symptoms can limit eating, reduce protein intake, cause dehydration, and make continued treatment unrealistic. Rapid weight loss can also reduce muscle tissue along with body fat. That matters for long-term weight control and physical function. Adequate protein and strength training help protect muscle, especially when appetite becomes very low. Gallbladder problems can occur during major weight loss, whether the loss comes from medication or other methods. Persistent upper abdominal pain, fever, yellow skin, or repeated vomiting needs prompt evaluation. Those symptoms should not be dismissed as ordinary nausea. After safety is addressed, the drug must match the main PCOS goal. For obesity and higher blood sugar risk, an anti-obesity drug may be reasonable. For immediate pregnancy, it is the wrong tool because treatment must stop and proven ovulation medicines are used instead. These drugs fit best when excess weight and insulin resistance drive the patient's current problem. Useful clues include a rising A1C, the 3-month blood sugar average, prediabetes, fatty liver, sleep apnea, high blood pressure, or repeated weight regain. Pregnancy timing also shapes treatment. Someone trying to conceive soon usually needs a fertility-focused plan, not months of dose increases. Someone delaying pregnancy may use the time to improve weight and blood sugar health with reliable contraception and a clear stop date. Symptom priority changes the value of treatment. If the main concern is facial hair, acne, or irregular bleeding, weight treatment alone may disappoint. If the main concern is hunger, obesity, prediabetes, and long-term heart risk, these drugs may offer more value. Those goals should guide testing before treatment begins. Blood sugar status, blood pressure, cholesterol, liver health, and pregnancy possibility often matter. Hormone testing may be needed when the diagnosis is uncertain or symptoms change suddenly. Once the goal and safety checks are clear, different symptoms need different treatments. Letrozole is commonly used first to trigger ovulation when pregnancy is desired. Metformin may help selected patients with blood sugar problems or insulin resistance. Birth control pills can regulate bleeding and improve some hormone symptoms when pregnancy is not desired. Spironolactone can reduce unwanted hair growth and acne, but it requires reliable contraception because of pregnancy risk. These options do different jobs. Wegovy and Zepbound should not be judged as failures when a separate symptom needs a separate treatment. When weight treatment fits the goal, choosing Wegovy or Zepbound depends on benefits, side effects, coverage, and pregnancy plans. Zepbound often produces greater average weight loss in obesity studies. That does not prove it is better for every PCOS symptom or every patient. The highest dose is not automatically the best dose. Slow increases can reduce stomach and bowel side effects. A lower dose that controls hunger and produces steady progress may be more useful than a maximum dose the patient cannot continue. Follow-up should track more than the scale. Weight, waist size, blood pressure, periods, pregnancy intentions, side effects, and blood sugar markers can show whether treatment is solving the intended problem. Hair and acne changes should be assessed separately because they often improve slowly. Response should be judged against the original goal. If weight, waist size, blood sugar, and cycle pattern barely change, continuing indefinitely makes little sense. The plan should be adjusted rather than assuming every PCOS patient must respond. Treatment should also have a maintenance plan. PCOS does not vanish after early weight loss. The patient needs a realistic strategy for nutrition, muscle protection, contraception, long-term medication access, and what happens if treatment stops. Wegovy or Zepbound can be useful weight management tools when obesity and insulin resistance are major PCOS drivers. They can improve conditions that support regular ovulation, but they cannot guarantee fertility or erase every hormone symptom. The right choice depends on the goal treated now. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.